not my first rodeo. I've lost count of the number of pandemics that I've been responsible for trying to plan strategies to manage. For me, yes, it is, I guess it's those things on steroids, but essentially the principles are the same. And so, no, I don't panic. I don't panic. I know that we can handle it. And I have a supreme confidence in my team and in the clinical and non-clinical staff at the hospital. I think they've been amazing. I think they've done an incredible job, and I think that we have really worked very well as a team.
A team was deployed to battle COVID-19 in this community in just 5 days. We worked with elders, liaisons officers, and the local staff and the hotel staff to provide reassurance and attend to their medical and social needs. It was a rewarding experience being able to give back something to community and the care of children and see the difference we were making to reduce the severity and spread of COVID-19.
There was no escaping from COVID, so you'd be there at the hospital, you'd be talking about COVID, and you'd come back home and you'd be talking about COVID, and it just never went away. So I really felt like I was sleeping, breathing, dreaming COVID. Yeah. A good moment when I went down to the vaccine clinic and got my first Pfizer injection. And I went down with Brett Ritchie, who's one of the other infectious diseases consultants, and we were literally jumping out of our skin. We were just so excited and realised it was just over a year since the pandemic had been declared and that we actually had a vaccine and it was in our arms. So I think before then you just felt really helpless and that there was nothing that we'd be able to do if this came to us. And then suddenly this vaccine came, and it was just I think the injection of hope that it gave, and the fact that it was so effective was just so exciting, and that science had been able to come up with this in a year was incredible. I think it's really shown to me that if we have one purpose, one thing that we're facing, we just all can work together really beautifully. And it's been one of the, I think, most amazing things about the pandemic is being able to work so closely with lots of different people. In my work with COVID kids and setting up the COVID Kids Clinic, I've had so much to do with lots of different people and in different areas of the workforce, all working together, and the strength that has come through that, I think, has been really eye-opening.
One of the things that really gets me is the very first time a patient manages to connect with a clinician on the video call, and there is a really brief moment when they connect that there's this look on the patient's face, just this look of relief. You know, that they can hear the clinician can hear them, so they're being seen, they're being heard, and they're being helped and they're being supported. And every time I watch a clinician connect with a patient, I see this brief moment of relief, and you know, they just relax that little bit, and that every time I see it, it really makes me appreciate what I do. I've not come across anybody that has just said, no, this is too hard, this isn't my job description, this isn't what I signed up for, I'm not going to do it. And I think that's the one thing that's I feel really quite proud of working here.
Oh, the telehealth, that was huge for us. We see a lot of different specialists. Like my daughter has about 8 specialists right now currently, and having to come into the hospital and taking that time out to travel into the hospital, find parking, go up and see the doctor for a 10 or 15 minute appointment sometimes. It was really challenging, whereas we finally actually got to have that at home. It didn't take so much time out of her school. It didn't take so much time away from the family as well, because you know, the siblings sometimes they get dragged along to all these appointments, and for him to not have to be dragged along a few times was a really big, that was great for us. Zoe was in Halo during some of this, and she was physically in bed. So for her to be able to access like psychological help with telehealth and still be able to see and hear from her doctors in a meaningful way, but she didn't have to go out in public and deal with all the embarrassment and the feelings that she was having already, just heightened on top of that. I think that was a really big one for us. You know, having a child who went through cancer, we lived through having to isolate for 9 months while she was in treatment, but the world went on. And so for us, COVID was almost like we were isolating again, but the world stopped with us this time. And it was a really cool experience actually to have other people kind of understand what we went through in a little way. I think I did miss hugs though. I really am a big hugger, so I did miss my hugs.
A standout moment for me is when I was in the middle of feeling very stuck about how to still maintain a connection with patients in spite of not being able to physically be in the room with them, is to create videos of myself connecting with the patient, using the child's name as much as possible, learning about their preferences through conversations with the family, and then creating a personalised video with music and musical experiences and songs that are familiar for the patient. So typically this would be my setup. I would be making the recording with this background. I would have my picture charts, wheels on the bus, 5 little ducks, and a range of other musical instruments, rain stick, my guitar, and the keyboard is right underneath this camera frame. It's really taught me instead of thinking outside the box, sometimes it's better to throw away the box idea altogether and just use a different shape for reframing and rethinking how to do things when you're faced with something that you've never experienced before.
And so because we are seeing all of the paediatric patients on our ward, it really has highlighted how flexible and adaptable and innovative the staff are, because we are seeing all these different specialties that we may not have seen before, but we know where to pull those resources for extra assistance throughout the organisation, and all coming together to help care for these patients that have come in with COVID. They've always worked amazingly as a team, but their teamwork has been heightened tenfold during these times. Just watching them work together and looking after each other, it's been very rewarding to be leading such an amazing team. Obviously it's got its challenges because these families are coming in with visitor restrictions and isolation requirements, so we're having to continually think of new and creative ways that we can support and reassure these families through these times. So we've set up new iPads in the room so that we can communicate with the families and ways that they can communicate with their families at home. Doctors can link in from wherever they are located if we need to have a doctor review. So it's things that I never thought that we would have been able to put into practice so quickly. Like things that probably would have been great a while ago, but COVID's given us that opportunity to push forward and put these devices and technologies into place really quickly, and they have worked really well.
When you're on the ward and you just see the can-do attitude of the nursing staff, really very inspiring. Where the hospital sits now is testament to that idea of prevention rather than trying to come in and control something. Yeah. Got an absolutely dynamic bunch and each with our own skill sets. So, when you're encouraged to use those skills and you can combine them, oh yeah, we're pretty dynamic. We can do a lot of things. Yeah, it's been very good like that. Very good and very cohesive, I think.
We have had a total of 15 different brands and sizes of N95 masks. We've had our friends from Worker Health work tirelessly to refit test staff when the supply became diminished and we had to trial different sizes. As you can imagine, all I dreamt about was N95 masks and whether all our staff were safe and fit tested for one each shift. Furthermore, we had to think fast and think quick. We were running out of spaces to isolate patients, hence the addition of our 9 pods. We had our education team and equipment nurse working tirelessly in order to get consumable and non-consumable equipment to stock these. This meant repurposing and obtaining equipment from other LHN, i.e. physiological monitoring, surplus defib from the QEH, portable diagnostic sets from outpatients that were then run virtually. then applying for new equipment via decision logs, i.e. foot pedal bins to safely doff our PPE, additional IV trolleys, and lastly, treatment trolleys.
Using non-verbals and body language and reading, people's different facial expressions, especially in those early days when you're building rapport and getting to know the woman and her family and her support. It was tough. It most definitely challenged your creativity when communicating and creating a safe birth environment, most definitely, yeah. The PPE can be really confronting for women and not what they expect when they come in to have a baby, and I can imagine can feel really quite overwhelming. So sometimes you do feel for the women, and you want to just reassure them that they've done nothing wrong. This is just the safety that we have now in our workplace and where you're having babies. So it can be, there's times, moments of frustration, but you look back and you understand that it's for safety, and you bring it back to safety of everyone in the organisation and who you're looking after as well.
Hi, I'm Sophie and I'm Louise, and we're both registered nurses who work here at the Elizabeth Grove Child and Family Health.
We were given an excellent opportunity to support the Women's and Children's Hospital through commencing our own pre-operative COVID swabbing clinics. We have 2 locations, one here in the north at Elizabeth Grove and one in the south.
We were very quickly able to set up this great facility to help support our families throughout South Australia, giving families opportunity to attend a more accessible site, limiting their travel to the CBD for these very simple COVID swabs. Making this more accessible service is just one way that the Women's and Children's Local Health Network continually to support families throughout COVID-19.
Come inside and have a look with us. Our clients will come in and take a seat here while we get their details, checking their 3 patient identification markers, their name, their date of birth and their address. We have our COVID swabbing room, and we also have our clean room here. We have our PPE ready and the certificates and stickers ready for the children when they're finished.
I guess I've learned how to lead a team, but lead a large team, and I've learned that you can't do anything without that team. So it's important to respect them and to listen to them. I guess the challenge to start with was staffing, and that was from the COVID testing clinic as well as the vaccine clinic, and how on earth I was going to find staff because we weren't allowed to take staff out of the wards, rightly so. And I do remember a phone call one evening, it was about 7 o'clock at night, and I rang a young nurse who had not had a job, and she'd just finished studying, and out of 5 that I called, she called me back. And I guess that gave me a little bit of hope that I actually could find staff. And we did, and we managed to recruit a lot of new nurses who will one day be the up-and-coming staff in this hospital. We need to encourage these young nurses. My passion at the moment is to bring them on board, and I think we need to support nurses who haven't had the experience that we would like them to have when they start in the hospital, and we need to nurture them, and we need to teach them and actually mould them as to, to the nurses that we'd like them to be, and to make the Women's and Children's Health Network proud. But we do all come together, which is nice, and at the pub, that's nice.
I'm Kelsey. And I'm Amy, and we did our grad in Paediatric Emergency Department. And we started our grad during the start of the pandemic, and during a time where the emergency department at the hospital was quite chaotic and quite busy. But in saying that, we did have a very supportive team that guided us very well through the pandemic. It definitely helped make us more resilient as nurses, helped build our confidence in ourselves and in our peers as well, and definitely upskilled us very quickly. But I think it was a very, very rewarding experience, and I don't think either of us would change it. Yeah, definitely challenging but rewarding.
Hi, my name's Marg Russell. I'm a volunteer in the holding bay for the Rogerson Theatres at the Women's and Children's Hospital. I love coming in every Tuesday morning. Volunteering at Women's and Children's has become an important part of my life. So the stop-start situation we all experienced as volunteers over the past 2 years has proved challenging. It was disappointing not to be able to support children and their families as they prepared for surgery, and to support the dedicated team in the theatres. It's a privilege to be part of the Holding Bay team, and I felt quite a sense of loss at not being there. I cannot thank Liz and Shannon enough for the way they work to maintain contact with the volunteer team and to keep us all together. During a period when we were able to come back last year, I was warmly greeted by the staff, who were so welcoming and grateful to have assistance in theatres once again. So many people came to me to express their thanks that I was there. It was overwhelming. When in fact it was I was so grateful to be back that the whole situation really rose to great heights.
Yeah, I think it's pretty memorable because it was my first day as the acting in the engineering and building service manager role. That was the Monday, and then the Sunday I got a call from one of the ED saying, can you please set up the COVID testing clinic tomorrow? So not only was it meeting a whole new team, starting fresh, learning everything, it was all of a sudden an insane week, 2 weeks, 3 weeks, which is now 2 years, of COVID. It's relentless, is probably the best way to describe it. And I think the constant, a health environment is so dynamic internally, let alone externally, and then you throw in a pandemic and it is exhausting. But I think that's where your team comes into it, and we just get through it together. I think it's probably creating that environment that we're all a team. I think everyone as individuals will obviously give their opinion, give their assessment, but then when you get everyone in a room, paint the picture and say, hey, this is the journey, I think we can do it, and we build that confidence together. And it took so much from everyone, from a time perspective, commitment perspective, around the clock, and then there was compromises along the way. Of course, it has to be. But we got there, and it was probably one of the biggest achievements and most rewarding moments last year.
When COVID first struck, I had also been struck with some health issues, and I was required to have brain surgery. So when the first restrictions came around, my boss decided that I would be the first person to start working from home within our team. The day I packed up and left will stay in my memory for a long time. I felt really worried, I felt uncertain, and I felt distressed because I hadn't shared my news with the other people, and I didn't know when I would actually see them again and what would be happening in the meantime to them, to myself, to our families, and to our broader community.
Whereas these days, we can happily work at home for a couple of days a week and have actually really good connection. And I think one of the best improvements has been MS Teams. I think those meetings are far more efficient when we hold them. You can see people, you can still gauge what's going on, but it's much harder for somebody to sort of hold court, so to speak, in a meeting, and you just seem to get down to business.
Now it's just a default to have everyone on Teams, which for me has been really great, and I think that's something that I really hope that we see in the future, is that really embracing of that workplace flexibility and being able to work from home. We've all had that glimpse into each other's lives, and I think that also gives us a real understanding of where everyone's coming from, and I think it just really helps us bring us all together. But to be able to have the choice and the flexibility, and I think it's been a really great side effect of the pandemic.
Luckily, out here in Enfield, we've been blessed with this beautiful space, this garden space. Some of the ways that I might use this space with young people and their families is in order to get them out of that traditional sort of clinical space, where we move away from what they perceive as maybe their deficits or what they're here to get fixed. Reconnect them back into nature, that sort of organic relationship that we have with the earth. When we dig our hands in the dirt, and young people dig their hands in the dirt, they kind of get transformed to that other space. So we can sort of hide the therapy in the work that we're doing. So another way I use this garden space is to grow vegetables. So we've done planting of sunflowers and cucumbers and zucchinis. And we can use those metaphors and those analogies about planting seeds, about nurturing it. What do we need to grow into strong young people? You know, we need to get good sleep and all that kind of stuff. So yeah, it really helps to sort of contextualise that for young people.
Look, I think the network at Women's and Children's is extremely supportive, and whenever I put a call out for help, I had lots of people across the network willingly help. They did extra hours, they did different roles. There was nothing that people wouldn't do to help you. Everyone was kind of in it together, so I think that was really helpful. We don't know all the answers. It is a disease that keeps us on our toes, and we've had to change and think differently and also try to keep forward thinking at all times. So I think that's key, is that remain flexible and open and adaptable, and don't be too hard on yourself if you have to change things or change a decision.
Well, people have actually changed and done something really different to make sure that families and children haven't had to come to the hospital and have been supported in their own homes. So for the exec team, but also the wider organisation, resilience again, but above everything else, commitment. Commitment to what they do, commitment to coming to work every day and working really, really hard to look after the patients, to provide fantastic care and to look after the wider community. I think the biggest thing that has struck me, and that I think is the one thing I will take away from the whole experience, is the way that the whole organisation, no matter what anybody's job has been, no matter what shifts they do, no matter where they work, have all pulled together, have been totally committed, totally bought into the whole thing and given everything to support the community and each other. I think that's been absolutely astounding, and I think we've seen it across the state, but I think particularly here at the Women's and Children's Health Network. And that's the one thing that will stay with me, the way everybody's stuck together, worked together and supported each other throughout the whole process.